Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi, everybody. Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we're still talking about opioids, but now we're talking about how to prescribe them. And in our first part of this two-part episode on how to prescribe opioids, we talked about the patient history and identifying substance abuse issues. But now we're going to talk about education, because that's also part of the process. Educating the patient on adverse effects, the potential for overdose, including how to best, store or dispose of unused doses of opioids lest they fall into the hands of children and cause overdose, right? Addiction, the potential for addiction. Why the practitioner, you feel the opioid is necessary, but also other alternative treatment methods if they don't want an opioid. All of that is involved in educating the patient along with just the prescribing process. But beyond educating the patient and getting them into the fold, if you will, and getting them involved in the decision process, you have to be able to prescribe appropriately. So what does that mean? It means benefit versus risk. Everything in pharmacology is benefit versus risk. So is the analgesia that you are attempting to accomplish with this opioid meaningful enough that the benefit would outweigh the risk? Like what? The potential for adverse effects, or the potential for aberrant behaviors that exist that you didn't recognize or didn't know about, or the patient lacking awareness of those risks, not even being aware they are at risk. So everything you're attempting to accomplish with this opioid, that benefit, does that outweigh the risk to the patient and their overall health? If you can say yes to that question, then yes, you're prescribing appropriately. But if you have any doubt in your mind that all those other things may be an issue, then you're not really prescribing appropriately until those issues are cleared up. And as always, if you are going to, as I like to say, because I'm a, more seasoned dental person, put pen to paper. But most prescriptions are done electronically now, right? You're always going to do the smallest effective dose, right? For the smallest number of doses. Just enough, but not too much, right? And you want the shortest appropriate period of treatment. So you want the smallest number of doses and the smallest effective dose for the shortest period of time. And above all, you never want to prescribe it with PRN directions, as in, take one of these tablets as needed for pain. Because that means the patient's going to think they can take as many as they want, right? Very specific, very clear instructions for use so that there's no ambiguity on the patient's part. They know exactly how to take their opioid exactly as you intended. So, well, my friends, that's it for our discussion of opioids, and that's it for this episode, or issue, if you will, of Fast Facts Pharmacology. Until next time, my friends, I can only say this. Have a good day every day, and be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products, from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.